Hi guys, I'm Fiona, I'm one of the consultants here. Thanks for attending teaching today. Today we're going to do something called a Resus Drill, which is a little bit different from simulations that you're used to. It's a bit shorter and it's targeted at those conditions that are time critical, life-threatening and need us to have rehearsals because they're not things that we see very often, called halo events, high acuity, low occurrence events. So when we do the Resus drills, the actual scene that you're participating in is only going to run for 5 minutes. Then we'll step out, have 5 minutes conversation and see what we've learned, and then we're going to do a rerun so that we learn how to do it better second time around. That's good because we remember things better if we do them twice, but we also feel a little bit happier if we've had a second chance to make it look better. Okay? So James, we're going to put you to the test as the team leader because that's the role you normally take in real life. And we'll try and make it as realistic as possible. So Ella, if you can be foundation doctor, PGY1, which is what you are anyway. Zoe, you're going to be the senior nurse in charge of the Resus room, which is your normal role as well. And what we've had is a phone call from the ambulance service, and Jane has just taken the call and she's just finished writing the information down, and that's where we're actually going to start the scenario 5 minutes. Right guys, so your scenario is starting now, starting with Jane has just put the phone down from this call information. Off you go. Dr. Von Happen, we've just had an ambulance call phone through.
All right, Jane, what's happened? Oh, this looks bad. Let's just get a team together and we'll brief all together. I think we need a second nurse, so maybe if you find Phil, I'll find Ella. Can you come and help?
I've got Fab in here, 3 minutes.
Hi, James, one of the Regis. I'll be the team leader. So this is a nasty one. So it's a young man being stabbed. He sounds like he's very unwell. So I'm going to call the trauma team and get the ED consultant and the nurse in charge. Perhaps Ella, can you set up to do the A to E primary survey when he arrives? Phil, could you get IV access and get set up to perhaps run some fluids once that's ready? Okay. And Jane, if I ask you to do the observations and set up the monitors when he gets here?
I'll go get the snacks as well.
Thank you. Right, let's get set up then. Hi there, hand it over to me if that's all right, please.
Okay, hi, so this is Andy. Andy's a 22-year-old male. He's been stabbed about 30 minutes ago. He's got a wound to the left upper side of his abdomen and his BP's just been dropping just as we've called up in the ambulance.
Right, thank you very much indeed.
Just going to pop this on your arm, Andy, alright?
I'm just going to pop a needle in your arm, Andy.
I think we're going to need to get this top off so we can look at his chest properly. Pop that in his fingers then. Activating the adult methadone protocol. So your patient's respiratory rate has slowed and he's not moving anymore.
And he's not he's crashed, I think.
Oh, right. Okay, looks like he might have lost output. Do you want to lay him flat, Ella? And just start again from A?
Yep.
Can you check a pulse, please?
There is no pulse.
There's no pulse. Right, this is traumatic cardiac arrest, so don't start chest compressions. Decision made, we're going to open the chest.
Anaesthetics, what's happening?
Oh, anaesthetics, Dr. James,
Hi,
team
hi.
leader. This is a young man, single stab into the chest, traumatic cardiac arrest.
Yeah.
I'm going to open the chest. Could you intubate, please?
Yes, that's fine. I'll sort that out right now. If somebody could bleep an ODP for me as well, that'd be great. Okay.
Just straight away.
So I'm the ED consultant. I've just arrived. What are you going to tell me?
Dr. Davis, thank you for coming. This young man has had a single stab wound to the upper abdomen. He arrived conscious. He lost output less than 5 minutes ago. He's been intubated. Decisions made to open the chest and perform emergency thoracotomy.
And your time is up. 5 minutes. Well done. Well done. Let's put everything down. We can tidy up in a minute and we'll go and have a little chat about how that went. Okay. Right, well done. Hope hope you enjoyed that. It's not an easy scenario, it's designed not to be easy, and that's the whole point of why we're running this as a drill, because it's practice, practice, practice. So what we're going to pick out just in the next 5 minutes is a few things that we think we can improve second time around, and then we'll do second time around. Same thing, 5 minutes, okay? So anybody who's had a look at the website and things, have you seen our setup and what setup is, what it means? It's something for a team leader to think about the minute they receive that kind of information. Honest question for you three, who heard what the paramedic said?
I didn't really, because I was doing the
Yeah.
I don't think I did either.
So the way I look at it is what's another 5 seconds? It's 30 minutes since the patient was stabbed, so it's worth another 5 seconds. And I would make that quite authoritative. It's right, can everybody be quiet? Let's all listen to the handover. Really clear communication, because team leaders need really clear communication.
I actually didn't notice you until you got your hands on the patient, but I was busy at the time setting up for the thoracotomy, so I'd lost awareness there.
And that's so important because you now had to get hands on, and then you lost that step back goldfish view of being able to see around. Ready for round 2?
Yeah.
Right,
Yeah.
let's go. Right guys, we're ready for round 2. So we're going to start at the same point where Jane has just taken the information from the ambulance service, and your 5 minutes starts now.
It looks bad actually. Let's get a team together. Who's around? So Phil, I can see you, and Ella, one of our foundation doctors. James, I'm the Res, I'll be a team leader. This is a nasty one, so it's going to be a trauma. So 19-year-old stabbed to the abdomen and he sounds very unwell. So I'll be a trauma team leader. While we're setting up, could you go to the fridge, get the intubation drug box, and put it on the airway trolley, and then set your equipment up? Right,
Remember
thank
what we
you.
said at the end of primary survey? And report back to me.
Oh yeah, thank you. And as you do your primary survey, just call the findings out so that I can hear them. Hi Zoe, right, patient's here, so hello paramedic, you'll be handing over to me if that's alright.
Lovely, no worries.
Everybody listening to loud and clear.
Can I have the doctor in charge to Resus, please? Airway patron.
Airway patron, thank you.
Hi, I'm anaesthetist.
Hi, what's your name?
My name's Emily.
Ellie, I'm James, I'm the trauma team leader. This man has just been stabbed. He looks very unwell.
Yeah.
At the moment we're just doing the primary survey, but we've got the intubation drugs out, so I think we're probably going to need that.
And your ED consultant has just walked in the room.
Hi Dr. Davis, James, trauma team leader. This young man's just been stabbed to the chest, he's lost output within the last minute. I'm going to perform thoracotomy. Would you mind being Dr. 2?
Yeah, that's fine.
Ready to go with the procedure?
Time's up. Well done.
number is 3.
Oh, welcome.
Right guys, that was brilliant. That
Oh,
was really good.
pretty
You enjoyed that?
Yeah,
Thank you so much, Andy, medical student, for being the patient. We always find that actually having a real person there is much more effective than a mannequin. I hope you found that. Okay. Good. Okay, so what was better second time round? Firstly, we got to 5 minutes and you were streets ahead, weren't you, in terms of you were already starting your thoracotomy, weren't you? So our absolute number 1 goal, we achieved that. But what else? What else was it? TXA.
The closed loop communication is really good. Everyone
Yeah.
reports
Yeah.
about when they've done their tasks.
Yeah.
Name
Gave you a bit of a prompt for that, but yes, more closed loops. So keep remembering that closed loop communication. Can you do that and get back to me? Can you do that and get back to me? All good things?
Name stickers.
Name stickers.
Sounds like we achieved a whole lot more in that time.
We did.
First time.
That 3 minutes
Lots
lots is done.
Yeah, absolutely did. Yeah. And when James was tasking me,
Told you what to do.
yeah, brilliant. He's been stabbed, he's lost his output, you're doctor number 2 on thoracotomy. That's all I need to know. It's fine, brilliant, absolutely good. What I suggest you do to layer down your learning is to have a think about it again this evening or tomorrow and just have another mental dress rehearsal. Try and do the same in a week's time and a month's time, another mental dress rehearsal, so that when the time comes, you've gone through this in your head several times, okay? We've also got here some resources. So if you go onto the website, you'll see the entire instructor pack here, and the additional resources are at the end. Those have been handpicked for the best of free online access medical education resources for thoracotomy. So you'll find videos, how to, okay,
No, thank you.
so happy practicing.
Thank you.
Thank you.
Okay, thanks Dean.
Thanks.